Digital pathology lab gets introduced first time in India by Optra Scan. OptraSCAN Digital Pathology Lab product conceptualized by biomedical engineer and technocrat Dr. Abhi Gholab, founder and chairman of Optra Group. This revolutionary product will replace optical microscope and usher in era of objectivity in cancer diagnosis and research. War against cancer just got a worthy and powerful ally in OptraScan's end-to-end digital pathology platform and solutions that seeks to bring in greater objectivity and precision in both cancer diagnosis and research. While talking to the national media community, Dr. Gholab said,
So what we have done is that you have seen this kind of a microscopes, and this microscope is an optical system that is there in the market for like hundreds of years. And if you go to any lab, you see this kind of systems. What is the benefit of this system is that pathologists are used to look into this system, on this kind of a glass slides, and these glass slides have cancer tissues. So if there is a patient who comes with cancer symptoms, then such kind of slides are made and they are kept under this microscope. And pathologists will now look through this microscope and they will write it on the paper about the diagnosis of the cancer that they see on this slide. Instead of this, what we have created is a system which is a complete digital system. So don't use microscope at all. What you can do is that put the same glass slide into this system, and this system will essentially convert the glass slide into an image. So whatever the tissue that is there on this glass slide get essentially converted into an image which can be used for diagnosis. Now, biggest advantage of having this in the image form is because the algorithms, the softwares, the computer-aided technologies that is available with this device now can diagnose your cancer cases much easier. Also, the data can be shipped across the network very quickly. What does that mean is that if you are using a microscope and if I had to take a second opinion, then I had to create one more slide like this and send it through courier to my expert. But now, since it is in the image format, at the click of a button, I can send this data to any of the pathologists very quickly. So the patients who are sitting in the rural areas, the smaller villages, who are otherwise not getting an opportunity to get an expert advice from the pathologists and the physicians and the cancer surgeons who are sitting in the bigger cities, now they can get that advantage because now they don't have to travel, neither the doctors have to travel. Who will travel is an image. The image will go to any of the doctor in any of the city much easier, and then they can get an advantage of getting the diagnosis from these experts very quickly. So because of this, the device that is made completely in India for Indians and by Indians is useful to not only help get the better cancer diagnostics, but also help physicians and also pathologists to give better diagnosis because now they have more tools available. They don't need to sit in front of the microscope all the time in their labs, but now they can be anywhere and they can look at these images on their iPads, on their laptops, on their cell phones very easily. They can also give the diagnosis much easier. So many thanks to Government of India to validate this product, and we validated this product in the hospitals like Dinanath Mangeshkar hospitals and many of the leading hospitals where more than 10,000 slides are now scanned and analyzed, and Government of India has approved it, this as an affordable healthcare device, and we are now all geared up to make it available to the citizens of this country. Thank you.
the path-breaking solution has successfully completed the mass validation of its whole slide digital scanner with the continued support of the Government of India's Biotechnological Industrial Partnership Program and is in keeping with the Prime Minister's call for Make in India initiatives.